Thank you, Chair Sanders and Ranking Member Cassidy, and thanks so much to both of you for being here. So when I was a sophomore in college, I was really struggling. And thanks to my roommate, who recognized some of the signals and signs with somebody who's dealing with depression, she suggested that I go to a school counselor at my university. And man, that made a huge difference. I don't think I would have done that on my own. And I can see now that I was struggling also in high school. But having access to that care in my school setting made a huge difference because the barriers and the stigma that I would have experienced were sort of stripped away. And I share this story often, especially with young people, because I can see them kind of go, oh, finally, somebody is being real about this with me. This is one of the reasons why I've been so focused on expanding access to school-based care. And Ms. Nees, I'm really excited about the support that we have put behind school-based services. I've heard from places in Minnesota where we're doing this, especially in places, this is something I've been working on, helping schools partner with community-based organizations to get those services in schools. It makes a huge difference. But here's the thing. In Minnesota, we're go-getters. All of this money, 3 higher education institutions focus on training. That's fantastic. 1 school district has pursued this so far. So can you talk to us just a little bit about, because I have this feeling that we're sort of constantly putting grant opportunities in front of school districts. Some of them, especially rural districts, just do not have the capacity to even know about these opportunities, let alone act on them. Could you talk a little bit about that issue and how we are putting resources out there that is actually not that accessible to a lot of schools?
Yeah. Absolutely, and thank you very much for that question. And we hear that all the time about capacity, especially small districts not able to write for these opportunities. It's one of the many motivators to our Medicaid work, right, where we're really trying hard to make it possible for people that are in schools to work with their Medicaid agencies so that we know we've got lots of kids. Half the kids in our public schools are eligible for Medicaid. If we can help schools figure out how to recoup some of those payments, they can sustain things. They don't have to write a grant. And again, we know that with the 21 states that have access to free care rule, that's resulting in almost $6 billion of revenue to schools for services they want to provide. And that's, to me, how do we need the more people, and the people, we need to train more people, and that's something that you can do with grants. But I want this to be sustainable.
They need sustainable
for the long
funding.
term.
Yes, exactly.
And for small school districts to not be left out of that's really what we hope the TA Center and the guidance and our efforts to shine a light on this opportunity, that we can have more of that happen.
And let me just ask for clarification. How many states did you say are participating in this right now?
21.
21. So only less than half of the states are participating. And that is a decision essentially of the governor and the legislature.
Correct.
So this is another problem we have, Mr. Chair, is that in some places there's opportunity, in some places they're not, based on the calculations that state leaders have. Vice Admiral Murph, I'm used to calling you Vivek, so.
Call me Vivek.
You and I have had some really terrific conversations. I'm so grateful for your leadership on issues of social isolation, both for our elders as well as for young people. Now, I've had people say to me, Tina, like, you can't legislate away loneliness. But you've done research that really shows how we can think about this as a social determinant of people's health, and that can make a huge difference. Could you just speak briefly to that, because I think it's really important?
Absolutely, and I think I agree that you can't legislate away loneliness, but I don't think that that's the solution here.
Right.
I think there are steps government can take to help support community organizations to invest in research to understand more deeply the drivers and solutions to loneliness, but we also need community organizations, families, individuals, to recognize that this is an important priority for all of us. I worry that we have become a lonely and disconnected nation, and that has massive consequences for our mental health, for our physical health, for economic prosperity, for our ability to pull together in the face of adversity, whether that's a pandemic or another hardship. And for all of those reasons, I believe that addressing loneliness is a strategic and critical priority for our country. It's something I think we can do, and the people who give me most faith that we can do that are young people, because when I talk to them around the country, they are not waiting for others to step in. They are building programs at their schools to help connect one another. They're reaching out to support each other. They're talking more openly about mental health and issues like loneliness than any prior generation, and I think their leadership is going to be vital in us addressing this challenge.
Thank you. Thank you so much, Mr. Chair.
Thank you. Senator